But let's turn it over to Dr. Lindquist for some specifics about Omicron, as well as any other information he wants to add from a protection standpoint. Scott?
Yeah, thanks a lot. Thanks for setting it up about Omicron. So the biggest concern we have about any variant is it more infectious? And that is a concern for Omicron. There's around 50 mutations on the surface of this new virus that is not related to Delta. It appears to be an evolution of a virus outside of Delta. And the concern being not so much that it's going to be more deadly. It doesn't appear to be at this point, but it appears to be more infectious. So as Dr. Shah said, I mean, the big question I have about this is how effective are the vaccines going to be? And we don't know that information yet. How effective will the antiviral medicines that are just coming on the market right now going to be? And we don't have that answer yet. And how are monoclonal antibodies going to be against this? So a lot of this, we're all waiting. We're talking weeks before we start getting some of this information. So in the meantime, over a year ago, we set up a very robust genotyping program in Washington State, just for this reason, just so that we could pick up new variants that are coming in from around the globe. And we have not seen this. We have had no detections of this. We have been looking for it since the beginning. We look for all variants, and we will be very clear and transparent when we do see it. We are anticipating that we will see it. We know that travel restrictions have not been effective measures for controlling the spread of variants. We're hoping to slow this down. So we are very much, as a system, prioritizing contact investigation and case investigation around anyone who's traveled from a country that has Omicron or any other variant that becomes of concern. And again, genotyping, there is one inside clue to this virus. There's a thing called an S dropout, where several of the testing methodologies, if it doesn't detect an S protein, that is very consistent with this new Omicron virus. So we are asking any lab in Washington State right now that does this S dropout testing to send us all samples so we make sure that we're getting a good representation in Washington State. In addition to the sampling, where we do around 10% of all positives in the state, as Dr. Shah said earlier. I mean, we are number 6 in all the states of the US for doing this. So we have a very good chance. Remember, we were the first state to detect COVID. We're likely one of the states that's going to detect Omicron first, if it's not already here. And with that, I turn it back to you, Corey.